Welcome back. Safe sleep for infants may sound simple, but oftentimes mistakes are made. They're ones that can easily be avoided. This afternoon we have Vanessa Ladrije with the Toledo Lucas County Health Department, Cribs for Kids health educator, along with Dr. Kaylee Howell-McLean, a pediatrician with Nationwide Children, so we can learn more. Welcome to both of you. And Vanessa brought props here. We've got props. So this, obviously a crib and a doll baby in there. What can you tell us about this?
So we talk about the ABCs of safe sleep because we want our babies to always be sleeping on their back. So this is just a little mini display of what I do during my trainings. All our families do get a full-size pack and play with a little bassinet for their own baby. So this is just a demonstration of what safe sleep's supposed to be looking like at your home for your baby every time they're sleeping, either on a crib, bassinet, or pack and play.
Well, the health department obviously has a real interest in making sure our children are well taken care of and sleep safely. And Kaylee, is a pediatrician, very important. You see the tragedy sometimes of things that when children are not properly put to bed.
Absolutely. So unsafe sleep-related death is a common occurrence in this country, unfortunately, even in this county, Toledo Lucas County. This is something a lot of us in the area are working on. We've been working on a lot of messaging about safe sleep, getting the message out there that this really can make a difference and save lives. In Toledo Lucas County, the coroner's office takes a look at about 8 to 10 infant deaths related to unsafe sleep environments per winter or summer season, so about 15 to 20 every year. That number has come down, so great work, families. We're very proud of our families and all of our health partners who made this difference, with that number coming down 75% this past year. We want to continue that good work.
Vanessa, you deal with young parents, and I know I have 3 of my own kids. They're all grown now, but you know, it's very tempting when the baby's crying or you're really getting tired, bring the baby to bed, and that, oh my God, that's the worst thing you can possibly do, because A, it's unsafe, and B, it sets a bad precedent, and then the kid will always want to be with you in bed.
That is correct, for the reason why part of the 12 Steps of Safe Sleep by the American Academy of Pediatrics, we do talk about room sharing. I know I had to share a room with a sibling growing up, and so what we encourage is that you bring the bassinet or the pack and play right next to your bed, and the baby's still close by to you, sleeping in their own sleep environment throughout the night, making sure that there's no stuffed animals, no pillows, no bumpers, no loose bedding items, just baby on their back on a firm, flat, non-incline mattress.
How have things changed, with a pediatrician perspective, how have things changed in the science or the opinion on how you put kids to bed safely?
Yeah, so it's a common question, because in the older days, I mean decades ago now, there was different sleep advice from what there is now. So we see a lot of grandparents and aunties and other relatives who mean so well, but the advice has changed. We've had now decades of research that finds that this safe sleep environment, placing babies on their back alone, without bumpers, stuffed animals, blankets, placed on their back in that crib, bassinet, or pack and play, does reduce unsafe sleep-related death.
You know, it's funny because, yeah, generations change. My wife and I, we have 7 kids between the 2 of us, and we have a lot of grandkids, but like when we had a newborn, there's 2 now, my wife giving her son advice about how to take care of the baby, like, Mom, we got this. We have an app for that. Now we're raising our kids by an app. Okay, good. Have you experienced that too?
Yes, we have. Social media has really been one of a misleading conception of what safe sleep's supposed to be looking like. You know, about co-sleeping, those bringing the blankets in, which we always advise our families to reach out and use swaddles for sleeping your baby. Wearable blankets. At all costs. Again, every baby is different, but we're still going to, the message is still going to be the same. Practice safe sleep at home, your baby sleeping in their own safe sleep environment. Wearable blankets are great in replace of swaddling your baby. As you can see, there is a variety that how you could use them. Some come with Velcro, some come wrap. It's really easy and comfort for baby as well. But yeah, social media has been misleading a lot about co-sleeping for the reason why we have worked together here in Lucas County to bring down those numbers that the coroners was seeing at his office. So we want to thank everybody in the community and our pediatricians and nationwide being part of Toledo Now, actually who advocates for safe sleep. We have been able to see that being done within our community, and our community health workers talking and supporting the evidence that back sleep does save babies.
Kaylee, Vanessa, thanks for your time.
Thank you.
Hopefully everybody at home learned something there or just reinforce what we know is the right way to do it.
Definitely.
We'll be right back. Thanks.